Hey guys, so it's another video from my side without any clear, catchy clickbait kind of a thumbnail because the content itself is holds a lot of value. So the question says, which of the following is a provision under the PPTCT program for HIV? So the answer here is the C, the viral load testing at 32 to 36 weeks of gestation to determine the risk of HIV transmission to the baby. तो हमें यहाँ क्या रखना है? This is a very star topic for this upcoming November INI. So here we are going to do the provisions under this act. Okay, from Parent to Child Transmission Act for HIV infected women, HIV infected pregnant women. So यहाँ तो मैं क्या याद रखना है? Basically 3 ड्रग्स हैं TLD. ओके, सो टेनोवोविर, लामिविडिन एंड डोलोडग्राविर. ये हमें देना है फॉर लाइफ लॉन्ग टू द प्रेग्नेंट फीमेल इन्फेक्टेड विद HIV एंड regardless of the CD4 count and clinical stage of the disease. So clinical stage kuch bhi ho, whatever be the clinical stage and whatever be the CD4 count, we have to give this 3 drugs, okay, to the mother lifelong. Now the second and very important point is ki low risk infant ko we give nevirapine. For low risk infant we give nevirapine, and for high risk we give zidovudin along with nevirapine. So nevirapine देते हैं, उसके साथ we add zidovudin if the infant is high risk, and here we give it from birth to 6 weeks of age, and here we give from birth to 12 weeks of age. Okay, so for low risk we know कि ठीक है, we give it for birth to 6 weeks of age, but for high risk we can give it from birth to 6 weeks of age or we can also give it from birth to 12 weeks of age, because for high risk we can remember it as high risk है, तो low risk के लिए हम दे रहे थे for 6 weeks. So for high risk we can also give it 6 into 2, that is for 12 weeks. So this is how we can remember it. तो ये यहाँ पे important points थे. And then coming to the question, this one point कि plasma viral load testing at 32 to 36 weeks of gestation to determine the risk of HIV transmission to the baby. So this is another important point. Then we have to ensure this cotrimoxazole therapy, cotrimoxazole prophylactic therapy, okay, and early infant diagnosis using HIV DNA PCR at 6 weeks of age. DNA PCR at 6 weeks of age as per the guidelines. Okay, so let's wrap this topic up. So here we can see the important provisions under PPTCT Act for HIV. So this is a star mark topic for November INI. Okay, so this is very important. I was going through my GT reviews. I thought I should share this topic with you guys. So HIV counseling and testing for all pregnant women enrolled in the antenatal care with opt-out option. Yani ki there is an opt-out option for the women. So, yani ki they are not like, they cannot be forced to get the tested for HIV. Okay, and then lifelong ART. तो 3 ड्रग्स यहाँ पे याद रखनी है, टेनोवोविर, लामिविडिन, डोलोडग्राविर, administered to all pregnant and breastfeeding HIV infected regardless of CD4 and clinical count and clinical stage. Then institutional deliveries promote करता है ये एक्ट. Care of associated conditions यानी कि reproductive tract infections and all these. फिर उसके बाद exclusive breastfeeding promote करता है. And then this is the important point which was there in our question, that plasma viral load testing at 32 to 36 weeks of gestation to determine the risk of HIV transmission to the baby. Then इन लो रिस्क इन्फेंट है अगर तो जस्ट गिव नेविरापिन, अगर हाई रिस्क है तो नेविरापिन के साथ ज़िडोवुडिन भी ऐड कर दो. इट कैन बी गिवन टिल बर्थ, फ्रॉम बर्थ टू टिल 6 weeks ऑफ एज, एंड हाई रिस्क है तो बर्थ टिल 12 weeks ऑफ एज भी दे सकते हैं. ओके. Then the nutritional counseling is also included in this act, and psychosocial support to the HIV infected pregnant women. Ensure cotrimoxazole prophylactic therapy and early infant diagnosis using HIV DNA PCR at 6 weeks of age onwards as per the guidelines. So this is all about this topic, and this is a stomach topic and very important for the upcoming November INICET 2025. So stay tuned for more such topics and subscribe. And I'll see you again. Okay, goodbye.